You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, gum disease, how to get rid of it. So if you have bleeding gums, bad breath, loose teeth, it can be taken care of in just a few visits with Dr. Fleming. Dr. Fleming, welcome to the program.
Thank you, Randy.
Now, before we get into today's topic, because you do more than just gum disease, treat gum disease, tell us about your practice. I mean, who's the typical patient? What are the different services you offer?
Well, our patients range from the very young to the older crowd, and our typical patients are 40s, 50s, 60s, and they come into our office for a variety of reasons, some of which may be due to pain, some of which could be due to other services that can make them want to improve their smile. And we can start with something small, such as whitening. So whitening,
is that popular? I mean, the most popular thing?
Absolutely, it's popular. So whitening can make a person's teeth very youthful, can improve their appearance, give them more confidence, and it's a very small change that can make a big difference for patients.
Is it much better than the over-the-counter remedies?
Much better. We have different types of products that can work more effectively, so it takes less time. There's less sensitivity a lot of times than with the over-the-counter products that are out there.
Okay, good. So what else are you doing?
We also can do bonding, which can improve chips, spacing, a variety of problems with the teeth, and that's an easy visit to do the bonding versus we move on to other items such as we do white fillings instead of the silver fillings. So
all right.
Very nice looking fillings that are almost invisible by the time that they're completed.
Okay, you also do, now you have this wand that you put in their mouths. What is that?
So the wand is a device that is used to check for cavities in between their teeth. It's relatively new technology that uses, it's called CariView, and it uses a technology that can check and double check as far as x-rays go. It's not an x-ray, but it can tell whether or not there's decay in between the teeth at a small stage where we can take care of it with a smaller filling than what may show up on the x-ray as a larger filling. So what that means to the patient is that we can catch things at an earlier stage, which potentially can allow us to do a smaller filling. And that way it saves the patient money. They don't have to spend it on larger treatment, crowns, and we can take care of it very early. We also do restorative on dental implants. When a patient comes in missing 1 to 3 teeth.
So why, if you're only missing one tooth though, why get a dental implant over like a traditional bridge?
Because a bridge has a tendency to, we have to shape the teeth on either side of the space to allow for a bridge to be placed. And a dental implant does not involve the adjacent teeth. So we can have an implant placed, have a crown on top of that, and you're not involving 3 teeth instead of 1 tooth. But the big benefit in the long run is it's cheaper for the patient in the long run because they don't have a bridge that would be replaced at probably 10, 12 years. They have an implant that can maintain for a lot longer than that.
So it's like getting your tooth back.
So like getting your tooth back.
Okay, good. So you work together with a team.
Yes.
A specialist.
A specialist.
And you work together. One does the surgery and you put the crown on top. And
Yes.
those can last for as long as?
They last for
like your regular teeth.
Like your regular teeth. And they feel like your regular teeth, whereas the bridges may, since they're connected, they may feel a little bit different than would a single tooth implant.
So you're big on prevention.
Yes. The problem is getting patients to come in the office at an early stage. Oftentimes they wait till they have pain or things are a little bit farther gone because not a lot of people like going to the dentist.
Nobody does, right?
Exactly.
Is that true? I think you told me,
true.
but they like going to you.
They do like coming to our office.
Do you ever hear that? Like, no offense, doctor?
Oh, all the time. That's
really?
Very commonly
They say
said.
that to you?
And they said, no offense to you, but I really don't like going to the dentist. So
Do you have a comeback for that?
Well, within my practice, I have a good group of nice, professional, friendly staff members, and they make their visit tolerable, and they actually start to enjoy coming to the dental office. So
is that right? Okay.
That's right. That's right. So our goal is to have the patient maintain their teeth because it's quite expensive to lose teeth. And we would rather have them maintain their teeth and, fix the ones that we can have them maintain for a long time. For the rest
We
of their
talked
life.
about this in the green room. where like men especially, right? We go in when we're in pain,
Exactly.
when it hurts, a toothache. Other
Right.
than that, we try to do everything, all of our dental care at home, right?
Right.
So it is a lot less expensive, obviously, getting in there sooner.
Right.
Is that always your challenge? I guess that's every dentist's challenge, getting them in early.
Getting them in early, because if they wait for too long, they may end up with having something where maybe they can't maintain their teeth. Quite often we have a location that does all-on-4 implants, which is quite expensive, but if a patient would like to maintain their teeth, then we can work with them and we can do restorative that can fix what they have. And it all starts with prevention.
Okay. So we invited you on the program to talk about gum disease. What are the symptoms and what is it?
So periodontal problems are things that can be as simple as red puffy gums, bleeding upon brushing, bleeding with flossing.
Is that common, by the way?
Quite common.
Where some people, even when they brush,
Quite common.
they're bleeding? Okay.
And oftentimes they may think that that's normal. Bleeding is not normal.
Even a little bit on the flossing?
It shows us that there's some inflammation going on, which the inflammation can lead to destruction of the gums, destruction of the bone, so the gums can pull away from the teeth, causing the teeth to flare, get loose. These are all latter stages of periodontal disease, but it does start with red puffy gums, and so one way that a patient can tell if they have any sort of problem could be from the bleeding upon brushing and bleeding upon flossing.
Okay, so this is a bacterial infection.
It is a bacterial infection,
going on.
yes.
And it's the #1 reason why people lose their teeth.
Correct.
So, and we were talking about this. 30 million people, I Googled it, 30 million people have an upper or lower denture.
Yes.
And it all starts usually
with periodontal disease usually.
Okay.
And so, yes, quite a few people do get to the point where maybe that is the only treatment. However, we would like to get the patients into the office when the symptoms are much earlier, because then it will save them time, money, and they will also have their own teeth.
Now you have people, by the way, that you say their whole lives have transformed. You were
Yes.
telling me about a guy that never smiled in his life, you say, in front of people.
Right. So I have a patient that came in and had neglected his dental care for quite some time. So probably 10 years or more. Slightly overweight, didn't smile, had a lot of broken down teeth. So with him, we teamed up with a periodontist and also an endodontist and did some work on him to the point where when we were doing his photos at the end, he had lost 100 pounds from when we worked with him, and he actually told me he had never smiled before, so it was foreign to him to actually be able to smile. So when we did his pictures at the end, he smiled, and it was a little bit challenging for him.
So would you say he never smiled before? I mean, literally just...
He didn't know how to smile. He never was proud of his teeth. And
let's take a look. Okay.
so you can see how his smile is very strained.
Did you kind of make him smile in this one?
Yes, I said, I would like to see your teeth, smile for me. And that was the best he could do to smile. And so then when we finished, he had lost some weight.
Wow.
And he was learning how to smile. So he was a great patient to work on and a good case for us to see from start to finish, because it made quite a transformation for him in his life. So this patient came in with bleeding gums, his teeth hurt, he had a lot of broken restorative, and by the time that we were done, now he walks in, he has different smile, he comes in and there's just been a transformation, very confident.
So these people, by the way, with bad gums, right? I guess you have to take care of this infection first, even before you get veneers or before you get or whatever you're going to get.
Yes. So when a patient comes into the office, they need to have a good foundation which we can do the restorative upon. So that's why if you have bleeding gums, if you have loose teeth, we need to get that under control. So especially in this case, we know that nobody is too far gone. And if they come in with bleeding gums and flaring teeth, broken teeth, we can work with them to fix their periodontal condition, and then we can do the crowns and the veneers and things that are cosmetic that can help them to improve their smile.
Now, when you have gum disease or this bacterial infection in your mouth, right? Why do the teeth move? And then how are they able to stop moving? That's my question.
So the bacterial infection causes the gums to recede away from the teeth, can affect the bone, and cause the teeth to become a little bit more mobile. There's less holding them into the bone.
So the gums move away from the tooth
Right.
when you have this infection.
Yes.
And then they get loose. Interesting.
Yes. So as far as our readings go, we do a lot of measurements. So we can see over the course of time how the patient is doing. We ask them to work with their brushing and flossing. And in spite of what you've heard lately about not having the floss be effective, it is quite effective in reducing the bacterial count. So, you know, they do need to keep up with their brushing and flossing at home. The other reason why the teeth are loose is that the bone is affected as well in latter stages of periodontal problems. So you can go from gingivitis, which is very early, just gum-related inflammation, to the bacteria that affects not only the gums, but the bone as well. So if the bone recedes away, the teeth flare, there can be, you know, a lot of changes movement-wise with the teeth, and essentially that's a little bit more challenging. So we'd like to get the patient in earlier to treat them when they have gingivitis.
So your teeth could literally be crumbling out of your mouth, right?
They essentially can get more mobile, yes.
And you can reverse that, give them healthy gums again, and maybe nice teeth.
Exactly. We need a good foundation before we're able to give them some of the other cosmetic results, such as veneers, crowns. They need to have good, solid periodontal support with their teeth.
So you do full mouth, like I mean, you're equipped with your training.
Yes.
To kind of rebuild mouths.
Yes.
Is that right?
Yes. So we can do anything from single crowns, veneers, bridges, to full mouth cosmetic cases. And we diagnose what the patient needs and also what their desires are. So we can go from whitening, if they'd like to whiten and brighten their smile, to give them the confidence of a very beautiful natural smile. A lot of times patients come in, they may have worn teeth, and worn teeth and dark teeth can make the patient feel older, have less of a confidence about themselves, and so we can actually change their lives by...
So you've actually seen life changes, transformations.
Absolutely. We have had patients anywhere from CEOs of corporations that have come in, didn't like their smile, had gums at different levels that were also puffy, so we did periodontal therapy on them, got them healthy, worked with the periodontist to kind of even up the gums, and then we gave them beautiful teeth, and that could have been due to crowns, could have been due to veneers, but absolutely change your smile. If you don't like the shade of your teeth, and maybe you're middle-aged, then sometimes whitening can do the trick. Sometimes it needs a little bit more than that, in which case crowns, veneers.
Okay. So what is the treatment? Okay, so if you have bleeding gums, bad breath, loose teeth, how do you reverse it in your practice? What are you doing?
So when the patient comes in, we diagnose what problems that they have, and we go through a series of questions that determine what their sensitivity level is, whether they're having bite-related issues. We go through a variety of things so we can then determine what type of treatment is necessary. So they spend some time with me first, and then we will then do some possible deep cleaning, which may involve some medication. It may involve an antibiotic, laser therapy, which can help kill the bacteria that are underneath the gums and ultimately lead to periodontal.
So is that where this is living? I mean, it's mostly underneath the gum line?
Underneath the gum line, yes.
Like on the root?
Yes.
Or just the bottom of the tooth?
Underneath the gum line on the root, and it is like barnacles on a ship.
Okay.
So you have to clean off the barnacles in order to get rid of the infection.
So that's the deep cleaning?
That's the deep
cleaning. They're like smoothing it out?
Absolutely, yes. So laser therapy is good to change the bacteria. It gets rid of the bacteria within the patient's mouth, and is actually shown to do so for about 90 days. So they will leave and have a fresh start. They will possibly have antibiotics that are given that they use at home. They also could have fluoride treatment if they have sensitive teeth, exposed root surfaces. They may need additional fluoride. which can all help to reduce and decrease the periodontal condition.
And how soon do those symptoms go away? Like the bleeding gums?
The bleeding gums can go away relatively quickly, and they at home will have to do their home care and maintain things. We will see them back in the practice on a regular basis to make sure that the measurements remain good and give them a little additional support when they need to have an update on their brushing flossing techniques.
Okay, so how often do they have to come in then for maintenance? Just standard 6 months?
Oftentimes, if there are periodontal patients, they need to come in about every 3 to 4 months because the laser will take care of the bacteria and for about 90 days.
So you brought some more photos. What else do you have?
Well, this is a patient that had a lot more problems that came into our office.
Oh my goodness.
This patient was one who had a drug problem initially, and we weren't sure, or the patient wasn't sure whether or not they could save their teeth. There was extensive decay, and what we decided to do working with the patient was we did some periodontal therapy, which included some medicated deep cleanings.
All right.
And got them back on track. And then the patient was unable to afford extensive dentistry. So what we did was we did some bonding, which gave the patient, we saved the teeth, and we did some bonding that gave them a better look. And it was a little bit less expensive than what could have been done had they had their teeth removed or if they had their teeth all crowned. So potentially they could end up with more extensive dentistry to be done, but they were able to get bonding and be able to smile.
Now you like saving teeth, right?
Yes.
And we had a discussion, and maybe, and I don't want to put words in your mouth, that you were implying that maybe there were certain centers across the country that are too quick to pull out the teeth. Elaborate on that.
So this patient could have very easily been in a situation where possibly the teeth would have been extracted, and but we were able to save their teeth and save them some money as well, because it's quite expensive to have
to lose your teeth.
To lose your teeth, absolutely. So this patient saved money and was able to smile again without spending lots of money.
So that's now. So when you are in your practice, okay, so you have the laser. You go around the mouth with the laser.
Yes.
And the laser disinfects the area.
Yes.
You do a deep cleaning with the hygienist.
Yes.
Right. That kind of starts them from a fresh start.
Yes.
Now the gums, and I want to make sure I understand this correctly. When you have this bacterial infection, they move away from the teeth. That means the gums move away from the teeth. That causes it to get loose.
Yes.
So when you clear the infection, the gums grab onto the tooth again? Is that kind of how it works?
Kind of how it works.
Okay.
When the gums get inflamed, they are infected and they bleed and move away from the teeth. And then once the bacteria are removed, then the gums shrink, kind of tighten up, and so they're tighter against the teeth.
Now you're a dentist. Of course, you probably think, and I always say this to dentists on my show, but you probably think the smile is the most important thing.
It is
How
the most
important
important.
is it?
It is the most important thing. It's in the center of your face. There have been studies that have shown that people notice a smile, and that's one of the top things. If a patient or if a person in general has a great smile, people notice that. It gives them confidence when they have a nice smile. Villains always have dark teeth and kind of missing teeth and this type of thing. Okay. So,
in the movies, they always have the bad teeth.
Yes, and so having a nice smile will boost confidence levels, and it's the center of your face. People are much more approachable when they have a nice smile. So if you go for a job interview and you are covering your mouth or don't like your smile, you don't exude confidence. And so a nice, bright, white smile can really give somebody some air of confidence, and possibly you would be the interviewee. If there are two interviews that have about the same skills, possibly a smile will make a difference. So we see transformations all the time. When we clean up their periodontal health and get rid of their bleeding, puffy gums and loose teeth, bad breath, oftentimes they go on to have the restorative crowns and partials done, things to replace the missing teeth. And oftentimes they're back on target with a beautiful smile. I had this one patient who is around 70-ish, retired gentleman, and he had a broken tooth right up in the front, missing teeth, and had just not been to the dentist in a while. And
like how long? Like what's...
Probably 10 years.
Really?
10 years. And so we did some periodontal treatment on him to correct the bleeding gums and the flaring teeth, bad breath, and used a little laser on him and got him back on track. We restored his teeth with crowns, bridges, and gave him the reason to smile again. So he no longer had the smile covering up his broken tooth in the front, and back on track.
Now, you're in Phoenix, your practice, right? You've been there 30 years?
Yes.
So you've seen people grow up, I guess, in your
Absolutely.
practice. Kids, families.
Families, and when the kids have kids, and yeah, I've seen them grow up in the area, and so my practice has been there a long time.
Okay, good. Now, we're talking about gum disease, right?
Yes.
Not one of the most popular topics, but for people just tuning in, I mean, if you have bleeding gums, if you have bad teeth, you have gum disease. Is that correct?
Correct.
Usually? But are there a lot of people where you are?
Absolutely.
That have this?
Absolutely. They're walking around all the time with, maybe they're afraid because it's been a long time. They might have bad breath. They might have no pain. They don't feel that they have a reason to come into the dentist, and when in essence they can have periodontal problems and not even know it, other than the bleeding gums.
So early treatment, obviously you save them a lot of money.
Yes.
So the laser, is the laser a big part of this treatment you do?
We do the laser on our deep cleanings as part of the protocol to clear up the bacteria, because the bacteria is what causes some of the periodontal problems.
Now, we are short on time, but at the top of the show, we talked about there are a lot of people that are getting teeth extracted that you believe that you could have saved those teeth. So there's a lot of that going on.
So yes, we've had some patients that have come in for a second opinion, and they were recommended to have their teeth out and have implants done.
Or dentures, I guess.
Or dentures. And so one patient in particular came to my office and was in tears. And we said, well, we might be able to help you. And so we did a thorough workup on this patient. She ended up going through periodontal therapy. She had flared teeth, mobile teeth, missing teeth. She was told that she needed to have her teeth removed and implants placed and have like a denture on top of the implants. And we were able to, after periodontal therapy was completed, she had some implants placed, some bridges done, veneers, whitening, and was able to maintain her own teeth, which was very important to her after hearing that she had no options and she needed to have her teeth removed.
So how come you were able to save the teeth and others? Is it a philosophical difference?
No, I think it was a location type of a situation where she went to a location and they told her that she needed to have her teeth all removed and implants placed with a denture on top. So
my point is, how come you weren't thinking like that? I mean, are you more thinking save the tooth?
I'm definitely thinking more save the tooth.
Okay.
Save the teeth, yes.
Is it less expensive that way?
Yes, quite a bit less expensive actually. And who wouldn't want to save their own teeth?
Right, but and you could clean them up to make them look good.
Yes. Clean them up and make them look good and save the teeth. That's kind of a primary, we're very preventive oriented. And so I would much rather work at saving someone's teeth if they are motivated to do so, because it's a lot better to have your own teeth than to have a denture.
Now you do a comprehensive evaluation. I mean, you even take some people, their blood pressure. Why?
Yes. There is a link between your oral health and your overall health. So if you have high blood pressure, if you have periodontal disease, if you have diabetes, these can all be linked. And so they're a chronic inflammation of the body. So you can have chronic inflammation in your mouth, you can have chronic inflammation in your blood vessels, high blood pressure, diabetes. So they're all linked together. So we look at the overall medications, how they can affect your teeth and gums, and it all starts with our initial comprehensive exam.
So when you clean this bacterial infection using the laser, the bleeding stops. Does their blood pressure go down? Do they feel better? Do they have more energy?
They
Is it
will-
like any other infection in your body?
It is, and they will definitely feel better. If they have high blood pressure, it may be that they have other issues as well. So I can't say that they're going to have their blood pressure go down for sure, but it is a chronic infection when you have periodontal problems. And
Okay.
so that's what the link is. We want to eliminate the chronic infection that's going on, and overall, health-wise, they will feel better.
So one thing we haven't talked about is the bad breath. So why the gum disease and the bad breath, why do they go together?
The area of the gum tissue can harbor bacteria in the gum tissue. So if you have a problem with bad breath, oftentimes it's the bacteria that release gases, and
All right.
The plaque and bacteria combined can cause some degeneration. If you have food within your teeth and you don't get it out, then as we get the deposits off of your teeth, get rid of the plaque through using lasers and deep cleaning, then that can help to eliminate those bacteria, eliminate the plaque, and reduce bad breath.
So have you ever had people that have a complete reversal of bad breath?
Absolutely.
Because of this?
Yes, absolutely. So there are, and what would be interesting now is to talk to the people that do have bad breath, and if they floss or not. I would imagine those people that are not flossers will have more bad breath than the people who are flossers.
Because like let's say you ate popcorn.
Right.
So it gets underneath the gum line.
Yes.
Kind of rots in there.
Exactly.
And-
It's decomposing food, and that is what is behind bad breath a lot of times.
Okay, good. Well, I want to thank you for coming to the show. We're out of time. So if somebody is watching this, they have bad breath, loose teeth, they're starting to get loose. They have bleeding gums, even when they floss. You suggest what? What do you tell them?
Come in. It's never too late to have your teeth looked at to eliminate your bleeding gums and bad breath. We can get you back on track, and we can give you a treatment plan that may give you a healthier, brighter smile.
All right. Thanks for coming to the show. Very good.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.